Welcome to my video series of medicine MCQs. Today will be endocrinology questions. Without much of talking, let's see the question. Here you can see the question. I'm suggesting you to answer this question within 2 minutes and compare your answers with mine. My answers, if there are any deficiencies in my answers, you can comment so I can also learn from you. I'm not the Mr. Perfect, I'm the helping guy. I'm happy to learn something from you as well. If there are any deficiencies in my explanation, in my answers, you can comment below. Alright, let's see the answers. The question is, in a pituitary tumor, the first stem is headache can be the only presenting symptom. Is this true? This can be true because sometimes in pituitary adenomas you will never see any other symptoms other than the headache in clinical scenarios. Sometimes these pituitary adenomas known as incidental lomas. Why are they called incidental lomas? 10% of the population, normal population, there can be hidden pituitary adenomas. Even in you, even in yours, in your pituitary, this adenoma can be there. That is 10% of normal population. Sometimes these pituitary adenomas hidden silently without doing anything, without making up any signs or symptoms. Therefore this stem is true. Let's see what are the other clinical features can be there in pituitary adenoma in advance. Pituitary adenoma can be there and make up some pressure to surrounding structures anatomically. Also, it can infiltrate into other structures and make some sign and symptoms. So you need to have some sort of a flashback, some sort of a memory recall, the anatomy of pituitary gland, where it is situated and what are the surrounding structures of it. The most common scenario of involving is it can infiltrate, can put pressure in the optic chiasma. When it put pressure in the optic chiasma, there could be visual field defect. It also can put pressure or infiltrate into cavernous sinus. When it put pressure in the cavernous sinus, the structures in it, the cranial nerves 3, 4, 6 can be affected. To remember that, I have my memory stimulator saying the couple 3, 4 and couple 5, 6 went to live in cavernous sinus. From couple 5, 6, Mr. 5 divorced and now staying only couple 3, 4 and 6. That is my memory stimulator. If you have anything to remember that what are the cranial nerves in cavernous sinus, you can have it. You just can skip that part. But I am suggesting you to have sort of a memory stimulator so you can remember those things very simply. Then this pituitary adenoma, pituitary tumor can put pressure on the skull and surrounding meninges. That is the reason you will have headache in here. And also it can put pressure into the hypothalamus, where the hypothalamus located superiorly to the pituitary. There you can have alteration of appetite, thirst, other symptoms. Therefore, like the symptoms like maniac, some symptoms like crazy fella, that suggesting mainly, that may be suggesting you or the person having a pituitary tumor, suggesting you to do other investigation and find it out. Also, it can give pressure into the ventricles. When it gives pressure into the ventricles, what will happen? CSF fluid flow will be obstructed, and what will be there? Hydrocephalus will be there. It can also infiltrate into the sphenoid sinus and lead into CSF throughout your nose. That is called CSF rhinorrhea. So simple as this first stem in headache can be the only presenting symptom. It is true. The second stem is MRI is superior to CT scan in diagnosing and will readily show any pituitary mass. What about this stem? This stem is classically true, and this sentence almost abstracted from the Kumar and Clark 9th edition. If you are referring, this MRI is superior to the CT scan and it will confirm the diagnosis of pituitary tumors, it will identify even small, very small microadenoma to macroadenoma. Sometimes some people go to MRI scan for other purpose and they will be diagnosed having microadenomas. 10% of population of them will be diagnosed as having microadenoma. This is found incidentally, so this is called incidentalomas. Also, other investigation part, if you are talking into, you can see the patient's visual field. You can protect by the visual field by using perimetry, or clinically you can find out, you can have an idea about patient's visual field by clinically using a red pen. You know the method, I'm not going into details here. You can monitor the symptoms or the signs of pituitary tumor by assessing patient's visual field repeatedly. The third step, the commonest visual field defect associated is homonymous hemianopia. Is this true? This is a big fat lie. Why is that? Usually pituitary adenoma, according to its anatomical position, usually it gives pressure into the optic chiasma. When it gives pressure to the optic chiasma, you all know what will happen. That is called bitemporal hemianopia. Usually the temporal sides, both temporal side, bitemporal. Hemi means half, anopia means the defect will be the outer half of your bilateral side in your vision. That is called bitemporal hemianopia. Also, upper quadrant anopia can be a visual field defect in, commonly found visual field defect in pituitary adenomas, but in clinical presentation it is found that bitemporal hemianopia is the commonest association with that. Therefore this term seems to be a lie, big fat lie. Also, other visual field defect can be there according to the tumor location and the pressure it's putting on, but the commonest association is bitemporal hemianopia. You need to remember that. The fourth stem is surgery is always eventually needed to remove the tumor. This is also seems to be a big fat lie. Surgery remains the treatment of choice. Surgery through the transsphenoidal route is the treatment of choice, but that is not eventually always needed. Sometimes this can be avoided. This is the management of pituitary tumor is multidisciplinary teamwork. What is this? Multidisciplinary teamwork means the combination of few specialists and doing the management. Who are those? Those are endocrinologists and neurosurgeon and the radiologist. They are get together. Why are they getting together? Are they getting together have a party and boost? Getting together. They are getting together to have the treatment of this pituitary tumor. They will usually have an idea of when to do the surgery and then go through with that. Sometimes treatment can be associated with using some dopamine agonist for the tumors such as prolactinoma. That will be the primary treatment for prolactinoma. Therefore, this statement seems to be a big fat lie. Also, radiotherapy can be used when there is no place for surgery, when the surgery is impractical. There is possibility to go through with the radiotherapy, but radiotherapy will not be affected as the surgery. That you will also have to remember. The fifth step, the last, usually secretes single unique hormone by its nature. Is this true? No, this is another big fat lie. Usually, the pituitary adenoma will secrete all those hormones associated with anterior pituitary. What are those? Prolactin. When they secretes the prolactin, they are called prolactinomas. They can secrete ACTH. When they secrete ACTH, that will end up in Cushing disease. They can secrete also growth hormone. When they secrete growth hormone, that will end up as acromegaly. Also, those other hormones, TSH, LH, FSH, can be secreted from these pituitary tumors, but they are really rare. other than the unique one hormone, there can be few hormones can be secreted in one pituitary tumor. That you have to remember. Sometimes in practical medicine we see this tumor secrete growth hormone as well as prolactin. Therefore this terms remains a big fat lie and it is a false. That is all from my end today. You can subscribe my channel Dr. BNA Health and hit that bell icon to get videos further about medicine MCQs. I'll be doing some videos about the pediatrics and I'll be doing some videos regarding losing weight and some other public health information, but do not distract from those. Just stick with me. When you see the video, if it is related to you, you just can see or you just can skip. Therefore stick with me. Bye bye from my side.